I came to know the speed vascular surgery program, sir. It's only one platform which is giving exclusive for vascular surgery, sir. Very thankful to you, sir. Attempted all the videos and the speed, sir.
If you're preparing for INI, definitely speed is the best platform.
Hi, good morning, doctor.
Good morning, sir.
How are you doing?
So fine, sir. It's a great honor, sir, to sit in front of you. I can't believe, sir. Actually, it's happening now. Yes, sir.
It's my pleasure to meet you today
Thank you,
and
sir.
the success story.
Thank you.
I bring in all the wishes and greetings to Dr. Akshay Kumar for scoring a topmost rank of CML2 in MCh Vascular Surgery in NESS session November 2025. Congratulations to you, doctor.
Thank you so much, sir. Thank you.
Great. Can we know your background, where you started till date, what I have done?
Sir, actually, I studied my MBBS in Mysore Medical College, and I did my MS from Government Medical College, Kozhikode in Kerala. Then I started working as I did my SRship for 1 year in Calicut Medical College only, sir. Then I joined as an assistant professor in a medical college in Wayanad. Then I, since 2.5 months from September, exactly say September in the beginning, I started my preparation for INA and also from the NEET assessor. Mainly my target is NEET assessor. Uh, Simultaneously, I gave exam for INAS also, sir.
Now it turned to be good for you.
Yeah, sir. But actually, only one seat is there in MCh Vascular. So in Sri Chitra, I don't know what happens to the rank one. It depends on that. Yes, sir.
Depends on that. Fantastic. So we hope for the best. Let us see
Yes,
what
yes, sir.
first ranker does.
Yes.
Okay. So can you tell us why vascular surgery is your interest?
Sir, actually, it's all goes to my professor Chandrasekharan, sir. I was with him and I was working in vascular unit with him. So he motivated me to take vascular surgery, and moreover, amputation risks are very high these days, sir. So always when we were residents, also we used to do lots of amputations. So vascular surgery can bring a change in that, managing the podiatry and also in the diabetic foot and the peripheral vascular disease, sir. So I wanted to pursue that branch, and it's more niche branch right now. So I wanted to do that, sir. And before starting my preparation, previous year I watched the same vascular surgery first rank video, sir. I didn't expect I will be here. It's a great pleasure, sir. Thank you so much, sir.
Great, great accomplishment and great move from watching to being.
Yes, sir. Yes, sir.
Fantastic. Now, can you know once you decide to vascular surgery, what you did and what all the preparation strategy to achieve what you achieved today?
Sir, actually, I started my preparation with NEET, sir. That's in the beginning of the September. So I took off from my duties. I stopped my practice and I started, sir. So initially, when I took the Rutherford book, it was around 3,000 plus pages. So I was little skeptical about going for INI, or shall I proceed with my NEET tests only. Then I came to know the speed vascular surgery program, sir. It's only one platform which is giving exclusive for vascular surgery, sir. Very thankful to you, sir. And the videos were really excellent. I want to thank the especially my distinguished faculty, sir, Pratap Kumar, sir. Sir, actually, he covered entire venous disease, point to point, embryology, especially, sir. Very thankful to sir. Then Shashi Kumar, sir, about endovascular topics, and vascular anatomy about by Rajan sir also. Then Raja sir. Then Marun Raj sir also has covered very well. Then Jay Krishna sir, to say lots of faculties only for one subject, sir. That's for vascular surgery. It was I really skeptical, sir, but sir used to say in the videos used to say like only read this point. This is enough. So I was only keen about that, and I just referred the tables from the report. And for a general surgery part, I did the tables from Sabiston, sir. That's what my preparation meant was, and all I attempted all the videos and the speed, sir. Then because only 20 days was my time period which was given for vascular surgery preparation, so I used the AI also, ChatGPT, and I used the Twin Mind app, sir, for taking notes. Easy for me.
Fantastic, fantastic. Great. Now, can you tell us something on the paper and what was asked in the paper and how many questions you got in the paper? How did you prepare? I mean,
So,
okay, no interview here, right?
yes, sir. No interview, yes, sir. Actually, 80 questions, general surgery questions were straightforward, sir, not difficult. Vascular surgery questions, almost all questions were covered from the video, sir. I made silly mistakes. I missed my first rank by 5 marks. That was, sir. But all the questions, sir, I can recall all the questions. Most of the questions were from the video itself, sir. By watching the videos, we can attempt all the questions, sir. It was straightforward. Yes.
Great.
Then MCQs also, sir. I attempted. It was tough in speed, sir. Actually, MCQs were a little tough, but still, it gave me a little edge over the exam, sir.
Okay. Now, what is the message that you want to give for the future aspirants of vascular surgery?
So vascular surgery, as such, if you're preparing for INI, definitely speed is the best platform. So that all the videos are there, and Rutherford is exclusively covered in that. And moreover, the tables are very important from the Rutherford and Sabiston as a part for general surgery. Sabiston tables are very, very important. The many last minute revision is very important for that also.
Great. So,
So one more thing, sir, I want to thank my professor, sir, my professor and HOD, Srijan, sir, my constant mentor, Professor Rameshan, sir, and my friends, sir, non-medical friends who supported me during this tough time, sir.
great. Anybody else want to thank? That's what I about to ask you. You did it. So,
Chandrasekhar sir, especially, sir, he's a vascular surgeon. He motivated me to take, and my senior, who is in Jaydeva, my Adip, Dr. Adip, he also is a constant motivation, and I'm targeting for Jaydeva probably if I get a good rank in NEET, sir.
Good. Advance wishes to you, and you will definitely get it.
Thank you, sir. Thank you so much.
Who introduced speed to you, and how you got into speed? What was your experience with speed?
Speed, actually, nobody needs an introduction, sir. For a INS preparation or NEET preparation, it's a straightforward platform. And moreover, my senior told me to see the speed, and I did a little workup because already the videos, previous toppers videos were there in the platform. I was motivated by that, and I took such.
Okay, great. Now, once again, we wish you all the very best and all the success as a great vascular surgeon in making, and your dedication, hard work, and passion towards this specialty of vascular surgery is going to deliver a lot to the department of vascular surgery and also to patients going to come for your services. Best wishes, advance wishes.
Thank you so much, sir.
And you keep us posted. We wish to know what's happening. And also for the NEET exam also, wish you all the best to get a topmost rank in vascular surgery in that as well.
Thank you so much, sir. Thank you, sir.
All the best. Yeah.
Thank you so much, sir.